would likely play out. How's it looking today? After President Trump embraced the House Republican plan yesterday morning, he then tweeted out yesterday afternoon, quote, "I feel sure that my friend Rand Paul will come along with the new and great health care program because he knows Obamacare is a disaster!" Exclamation point. Joining us now, Republican Senator Rand Paul, the president's friend from Kentucky.
Senator, the ball has been passed to you now. So tell us about, he apparently doesn't like the House plan anymore. Tell us about your plan.
Well, our plan is different. The House plan is Obamacare light, keeps subsidies, keeps taxes, actually keeps an individual mandate, and bails out the insurance companies. My plan would legalize freedom and competition. We would get rid of all the mandates so inexpensive insurance can be sold. We would allow health savings accounts to expand. Every Republican agrees with that. And we do something that nobody else is talking about in any of these bills. We let individuals join a group or join an association to get cheaper price and guaranteed issue through the marketplace, not through a mandate. One of the things that people are not talking enough about is every insurance executive told us if you keep guaranteed issue without the individual mandate, they will continue to hemorrhage hundreds of millions of dollars. That's why the House leadership plan has an insurance company bailout built into it, because it doesn't work. You can't have guaranteed issue and no individual mandate. That's why Obamacare put it in there. So what you have to have is a plan like ours that gets more people into group insurance and allows them to get guaranteed issue by getting group insurance and fleeing the individual marketplace.
So what do you do on the Medicaid issue? Obviously, a number of Republican senators came out yesterday, said they couldn't support the current bill because it's not generous enough when it comes to Medicaid. What does your bill do in that area?
We don't address the Medicaid expansion or contraction in the replacement bill. We think that should be addressed in the repeal bill. And that's the real point that I told the president when I talked to him on the phone, and we said in our press conference yesterday, is the Republicans are in agreement on repeal, but we're not in agreement on replacement. We're widely apart on replacement. I think there is unanimity on repeal. That's why we think we should do a clean repeal. So Congressman Jim Jordan and I introduced yesterday clean repeal, and let's vote on replacement same day, but separately. I think that's the only way this gets through.
Senator, I know you've got principled objections to this piece of legislation, but so do some of your Senate colleagues like Rob Portman of Ohio, who thinks it cuts Medicaid too much. So how do you expect the White House to try to solve that Rubik's Cube of trying to win over your support while you've already got colleagues who think the bill goes too far?
It is a conundrum, and that's why we should vote on the one thing that we all agreed on. About a year ago, we voted on clean repeal. We don't agree on replacement, but we could have a separate vote on Medicaid expansion. And I'm guessing Democrats and big government Republicans would probably come together and find that they will expand Medicaid. Many conservatives aren't going to vote for that, mainly because it doesn't work. We're dishonest in the accounting. We can't pay for the current Medicare. It's $35 trillion in the hole. The current Medicaid is unfunded, and then we're going to add new entitlement programs to that. If you really want to have Medicaid for everyone in all these states, you should be honest with the people, and you should double or triple the state income tax and double or triple the sales tax. Now, I'm not for that, but that's what it would take if you were honest. Instead, we say, oh, federal government's going to pay for it. Federal government has no money. We borrow $1 million a minute, so it's just dishonest accounting.
Senator, in your conversation that you just referenced with the president, in which you explained your position on the health care plan, it's a pretty detailed and complex proposition, no matter whose plan you're talking about. Do you think he fully grasps the details and the complexity of this plan?
I think the White House, the administration, and the president understand that there's enough conservatives that they can't pass Obamacare light. That's why this week what's going on behind the scenes is a charm offensive. Every conservative that's come out publicly opposed to this has been called by the White House and is being cajoled and wooed by the White House to give in. But if conservatives stay together, if we stick together, we will have a force and a negotiation, and we will talk about clean repeal versus replacement if we stick together, because I don't think they have the numbers to pass this at this point.
All right, Senator Rand Paul, thank you so much.
Thank you, Senator.
We really appreciate you being with us. Mika, some final thoughts.